Migraines, by definition, are headaches that are moderate to severe. These aren't mild headaches. They tend to be prolonged, so on the order of hours, sometimes even days for some patients. And they are, by definition, either associated with nausea and vomiting or light and sound sensitivity. And even after patients get out of the headache phase of the migraine, there's also a postdromal phase. So you have this lingering, tiredness, exhaustion, fatigue, lingering brain fog.
Migraine is the second most prevalent of all disorders on the planet. So not just neurological disorders, but all disorders. It is by far and away the most common neurological disorder.
Migraine doesn't respect age groups. It affects children, it affects adolescents. How could we let that go on? It affects adults. It even affects people in their older years. The percentage of people over 65 with migraine is about the same as the percentage of people under 12, so they're both a considerable group.
The underlying, sort of motivation is to try to develop new, novel, innovative, and effective therapies to try to treat migraine. So that's kind of our main overarching goal. And one of the ways that we're, really trying to go about that right now is to look at specifically the sleep-wake cycle and how that's interacting with migraine. So we know that sleep, changes in sleep, interact a lot with migraine. These microelectronics are monitoring the animal's cerebral blood flow, so the blood flow that's going on in their brain. It's monitoring their sleep-wake cycle. It's monitoring their motion, their movement. So one of the things that we're able to do is if we are able to intermittently induce a cortical spreading depression, which is again central to sort of migraine pathophysiology, we can induce that and just see what happens to sleep if we induce one CSD. What happens to sleep if we induce one CSD daily for a certain period of time? And vice versa, what happens if there's changes in the sleep-wake cycle? What happens if we sleep deprive an animal? So sleep disturbances can often kick up and trigger migraines for patients. We know that sleepiness is a core component for a lot of patients with migraines. So clearly there's this relationship, and we're trying to really tease out what's going on there.
When I think about migraine research and what's going to happen, perhaps in the next 5 to 7 years, I think about better understanding of the disorder, I think about new treatments, and I think about how we can deploy the treatments we get and the treatments we have in a much more efficient, patient-friendly and useful way. Another area of development I think is going to be quite important. As we understand the first part of a migraine attack, which is what's called the premonitory or prodromal phase, with maybe neck discomfort, tiredness, concentration problems, mood change, odd things like passing more urine or craving sweet and savoury things. These are all happening in the brain. Could we, before the pain, could we stop the pain happening? Can we understand enough about the earliest part of the attack and the attacks, indeed the whole of the attack, to prevent migraine and in effect cure it from a pain perspective? I think the answer is yes.
Those who don't have especially frequent migraine often really don't understand what an extraordinarily important public health issue this is. And it's also a women's health issue because the prevalence is higher in women.
These are women that are highly active and, working, huge contributors to society. And the fact that as a society, we kind of brush off those complaints as, oh, you're being hysterical or you're being dramatic is really a problem.
But now what we know, thanks in large part to some of the imaging and chemical studies, is that we can see different parts of the brain lighting up during different phases of a migraine attack, corresponding to the symptoms that people have. So for example, when they have light sensitivity, we can see the occipital region of the brain, which is responsible for processing of vision, becoming much more active. So we have kind of ways of validating and understanding the different symptoms of migraine. Rather than just thinking that they're somehow being made up by an individual, we can say, no, look, when you're having this symptom, this part of your brain is activated, or this chemical is elevated in your bloodstream.
The importance of developing more innovative and novel effective therapies is critical, and then bringing up the awareness of what migraine really is, right? It's not just a headache.
Migraine's not going anywhere, so investing in it is an investment in our children and our children's children.